Welcome to the Faculty of Health Sciences. The Faculty of Health Sciences at the University of Pretoria has a long history of delivering excellence in the education of healthcare professionals. The faculty has more than 600 full-time and part-time lecturers, researchers, and clinical practitioners who are dedicated role models, inspiring students to become #life changers. It's my honor and privilege to guide you through the faculty's postgraduate program that we have prepared specially for you. My name is Dr. Tsakani Hlongwane, and I'm your program director for this event. Before I hand over to the Dean, I want to share with you a few of the reasons why the University of Pretoria, specifically the Faculty of Health Sciences, is a good choice for your postgraduate studies. The University of Pretoria graduates are highly employable. The University of Pretoria ranked third in South Africa in the 2022 QS Graduate Employability Rankings, making our graduates highly sought after. With a dedicated Center for the Future of Work, the university prepares students for the world of work. The Faculty of Health Sciences ranked first in the QS rankings on sustainability in the category Good Health and Well-being, and ranked top 100 globally. The faculty is also home to a 21st century library. This library houses the virtual reality and an augmented reality toolbox. This is used to enhance teaching and training of our students through advanced technology, making them technologically capable and ready when they enter the world of work. The Faculty of Health Sciences is leading in research that matters. It hosts 6 research chairs, 13 research entities, of which 3 houses the South African Medical Research Council's extramural units. More than 30,000 University of Pretoria students are involved in community projects each year. I had the privilege of being mentored by Professor Robert Pattinson. Professor Pattinson is an NRFB-rated scientist, and he supervised me to complete my PhD in obstetrics and gynecology. I'm privileged and very proud to be associated with the University of Pretoria as a specialist obstetrician and gynecologist with a PhD. I'm part of the teaching and the research team at the Department of Obstetrics and Gynecology, and part of the team at the University of Pretoria's Research Center for Maternal, Fetal, Newborn, and Child Healthcare Strategies Unit. I never thought as an undergraduate studying medicine that I could be a clinician scientist. But the programs and the support offered at postgraduate level at the faculty opened my eyes to what is possible, and it offered opportunities that led me on a path of sustainable education and a platform through which I can help impact positively on the lives of our most vulnerable. For that, I will be forever grateful. On that note, allow me to hand over to our Dean, Prof de Jager, who will share with us the conducive environment and support that they have put together for our postgraduate students. Prof, we are delighted to hear from you.
Thank you, Tsakani, for the kind introduction. I'm thrilled to be here today to share with our prospective postgraduates the compelling reason why we proudly call ourselves #LifeChangers. This hashtag has evolved into a powerful thread that binds us as a family within the faculty. It has transformed our staff and students into thriving, inclusive, and diverse teams, all working together towards a common purpose. So, as you embark on your postgraduate journey in the health sciences, you are joining a family that will support you every step of the way. Within our faculty, you'll find many research entities that amplify our commitment to research excellence. Our research endeavors focus on addressing the health and healthcare challenges facing not only just South Africa, but the entire African continent. Our research ranges from cutting-edge laboratory science to community-based initiatives, all aimed at finding solutions to healthcare burdens. At the faculty, we've worked tirelessly to create robust support mechanisms for our postgraduate students. To guide you through your postgraduate journey, Our Deputy Dean for Research and Postgraduate Studies will provide you with a practical guide. We're home to leading researchers in various focus areas who offer supervision to our diverse community of postgraduate students. 4 research institutes, 7 research centers, and 2 research units are the hubs of groundbreaking research within our faculty. From stem cell research to sports medicine, from sustainable malaria control to cutting-edge imaging, from maternal, fetal, and infant healthcare to cancer research, we're at the forefront of research that matters. One of our proudest achievements is the Nuclear Medicine Research Infrastructure, or NUMERI, a collaboration with Steve Biko Academic Hospital. This facility establishes the University of Pretoria as a premier nuclear medicine research center locally, continentally, and globally. NUMERI equips our clinicians and scientists with state-of-the-art infrastructure, opening doors to modern treatment options and research opportunities. Our research centers delve into niche areas such as forensic anthropology research, addressing South Africa's critical shortage of forensic expertise. We're the only veterinary faculty linked to our institution. We lead in zoonosis and One Health research, evident during the recent pandemic. Our 2 research units focus on environmental chemical pollution and health research and urban population research for community-orientated primary care, or COPC. COPC is an internationally recognized approach to primary care that brings professionals, organizations, and communities together to address health needs systematically. In addition to these, we have community-driven research platforms, one focusing on urban and the other on rural populations with direct societal impact. Our rural population research platform has hosted human and environmental health research in the Vembe district in Limpopo province for the past 16 years. We recently launched a state-of-the-art health sciences library, setting new standards for learning and innovation, equipped with artificial intelligence systems, virtual and augmented reality training solutions. It also promotes collaborative student learning through technological and innovative methods. In closing, the faculty is committed to nurturing a new generation of healthcare professionals and medical scientists. Our research-driven teaching, combined with the latest technologies, equips you to address the evolving healthcare landscape shaped by the 4th Industrial Revolution. Together, we strive towards achieving Sustainable Goal 3, improving the health and well-being of society. Welcome to our vibrant, dynamic, and inspiring faculty. Together, we will change lives and make a profound impact on the world.
Thank you, Prof de Jager, for the informative presentation. I know as a new student, all this information is vital. Remember that the University of Pretoria has faculty-specific websites that are available for you. You can look through them, refresh your memory with details relating to information to your studies, and there's also contact details of relevant staff members. A good takeaway from Prof's talk is that the Faculty of Health Sciences has the trifecta that will make your postgraduate journey a success. This includes research-intense postgraduate programs that await you programs with community platforms for practical implementation and translation of your research findings. Our academic staff, they are exceptional, they are leading in their domains, and they are very keen to supervise students. Also, our facilities, the campus environment, the systems, the processes that are set up to provide postgraduate students with all the necessary support to ensure success. The University of Pretoria and the Faculty of Health Sciences has so much to offer. Prof Mashamba-Thompson is ready to break it down further. When starting out on the journey of postgraduate studies, it can feel as if you need a roadmap, something to help navigate you through the process from application to graduation. Our Deputy Dean is here and she understands this all too well. She's here to present you with a guideline to help you through and also share with you the dedicated support available to you as you embark on this journey. Prof, over to you.
Ladies and gentlemen, distinguished prospective graduates, I am thrilled to present our postgraduate offering in the Faculty of Health Sciences. A postgraduate degree in our faculty could change the course of your academic and professional life. I am frequently asked how to go about selecting a degree program. In our faculty, we have 245 postgraduate programs, of which there are 75 doctoral programs, 108 master's programs, and 34 honors programs. We also have 25 postgraduate diplomas. Information about our prospective or your prospective degree program, the department in which it is offered, and the requirements, it is clearly outlined in our University of Pretoria website. Now, here's the exciting part. We are not just here to earn degrees. We are here to make a difference. We encourage you to complete your thesis and dissertation by publication and publishing your master's and PhD research. Publishing your research will ensure that your work reaches the full potential, whether it be social, political, or economic sphere. One piece of advice, please don't hesitate to reach out to us. Each faculty has a dedicated support team ready to guide you at every turn. More information on your proposed study program can also be found at the Postgraduate Recruitment Office at University's Graduate Support Hub, which can be reached via email. Here's the email address, pgrecruitment@up.ac.za, or contact your specific faculty advisor if you have not already done so. The Fly Higher at UP program equips you with invaluable research skills, enhancing your knowledge readiness. The Faculty Research Support Hub complements the program by supporting students and staff with article processing charges, grantsmanship, scientific writing, graduate or postgraduate wellness, and data science support services. Our Research Support Hub services include methodological guidance for both qualitative and quantitative research, as well as evidence synthesis and translation training and assistance. Our Faculty Research Support Hub and Faculty Library Services are your steadfast allies on your research journey. We also have Faculty of Health Sciences Postgraduate Student Roadmap on our website. The roadmap will help you from searching for a postgraduate degree all the way to graduation. This includes supervisor allocation, proposal development, sourcing funding, to mention but a few. So, dear prospective postgraduates, you are ready to embark on this extraordinary journey with your passion, dedication, unwavering support, and as full support from our university community. You are bound for greatness. We look forward to seeing you in our faculty soon. Now let's watch a short video showcasing the extraordinary support services offered by our dedicated Faculty Research Support Hub. Greetings all. My name is Prof Mashamba-Thompson, Deputy Dean for Research and Postgraduate Studies at the University of Pretoria's Faculty of Health Sciences. It is my honor to introduce to you the Faculty of Health Sciences Research Support Hub. The Faculty of Health Sciences Research Support Hub will be formally launched on the 4th of July 2023. The concept of establishing the research support structure was presented at the faculty's implementation plan for 2023. The purpose of this hub is to have a central base for research support and resources, to be the starting point for our staff and students conducting research or other scholarly and innovative activities within the Faculty of Health Sciences. Our intention is to align our services with those offered by the Department of Research and Innovation, DRI, to customize DIR services to the needs of the Faculty of Health Sciences where required. The Faculty of Health Sciences Support Hub will host regular events aimed at boosting the Faculty of Health Sciences research and innovation in order to promote research productivity and excellence. The objectives of the Research Support Hub will be aligned with the present year's university research priority areas and focused on meeting the faculty's research performance targets. Our 2023 services under the Hub will be aimed at addressing the following objectives: to improve access to research methods, grantsmanship support, and research mentorship, to improve translation of research into policy and practice, and to improve research quality and productivity while addressing systemic barriers to research transformation. For more information about the Faculty of Health Sciences Research Support Hub, please visit the Faculty of Health Sciences Research website. We look forward to providing you with responsive research support that will empower you and enable you to thrive in your research and academic endeavors.
Thanks, Prof Mashamba-Thompson. Remember, the roadmap is available on our website as a download, and it can be easily viewed on your mobile devices. If there's one thing that I know all of us want to know more about, it's the matter of funding. On the University of Pretoria's website, there is a page dedicated to postgraduate funding. This page has extensive funding information for the University of Pretoria and for external funding opportunities. Please check it out. Now, we are thrilled to hear from our dynamic postgraduate students, and these students, they are really trailblazers in their fields. Let's meet them. We have Dr. Candice Hendricks. Dr. Candice Hendricks is a pediatric clinical hematologist, and she's also a PhD candidate at the Institute for Cellular Molecular Medicine in the Department of Medical Immunology. Dr. Candice, welcome. We are excited to hear from your experiences and your journey at the University of Pretoria.
Thank you very much, Tsakane, and hello everyone. It's really a pleasure to speak to you today about my research and why the University of Pretoria is the only place where it could happen. Within the broader theme of hematopoietic stem cell transplantation, which is also known as a bone marrow transplantation in children, my research is focusing on umbilical cord blood derived hematopoietic stem cells. So in short, these cells refer to the blood stem cells that we find from the cord blood after the baby is born. And I am characterizing these umbilical cord blood stem cells from HIV-exposed infants that are HIV negative at birth and determining whether the antiretroviral drugs that the mothers take during pregnancy have any effect on the stem cells of these babies. But you may ask, why is this even important? Well, firstly, by determining whether the stem cells of HIV-exposed infants behave in the same way as the stem cells from HIV-unexposed infants, we are opening up the possibility of using these cells for bone marrow stem cell transplantation. And secondly, we will also be able to determine whether any impairment in the blood stem cell could be responsible for hematological abnormalities that we see in these infants. And I believe this research will be very important in an HIV endemic country to allow for the inclusion of HIV-exposed donor sources, because much of the problems that we have in South Africa is due to a paucity of donors. It has been an immense privilege to undertake this research under the tutelage of one of the stem cell giants in our country, Professor Michael Pepper. In this way, UP actually chose me and not the other way around, because I chose Prof Pepper first and he was at UP. And although I never imagined that I would move to Pretoria, I can say with confidence that I could not be happier with my choice. The supervision has been excellent and adequate funding has been made available for all the work that I've undertaken. Importantly, the security of the funding was given to me up front. And although I have applied for other grants during my PhD, I've never been asked to actually shoulder the burden of additional funding, and Prof Pepper has always ensured that my research was never stalled as a result of lack of funding. And outside of our own institute, I have continuously been impressed by the professional and efficient manner with which all academic activities have been undertaken. Each contact person for each component, whether registration, application for article processing charges, grant applications, applications to the PhD and ethics committees, have always been quick to respond and willing to help. And this has made the administrative components related to the PhD a true pleasure. Faculty Day has also been an absolute joy for the past 2 years, providing a wonderful opportunity not just to showcase our own work, but to appreciate the vast array of research that is being performed in the health sciences faculty. I had the privilege of serving on 2 panels on these faculty days, and it was humbling to observe the passion with which my fellow panelists undertake their research. Many new networks have been created, and I actually found a critical collaborator for my ARV research while I was sitting on a bench having the lunch break during last year's Faculty Day, showing the importance of this day. Being a UP student has enriched my life. It is a university I will always be proud to be an alumnus of, and I stand here today exceptionally grateful for this opportunity that has been afforded me.
Wow. You know, the Institute for Cellular and Molecular Medicine is the only institute that does this groundbreaking work in South Africa. Dr. Candace, you are doing innovative research with potential to change lives. We can't wait to see where this research leads you. Next, we have Mr. Keith Ngube. Let's meet Keith. Keith is a lecturer and he's a PhD candidate at the Department of Pharmacology. Welcome, Keith.
Thank you so much for the introduction. So my journey at the University of Pretoria actually started 10 years ago, and I look back in amazement at the naive young man who started his BSc in medical sciences with an undergraduate degree in 2013. So from my second year onwards, I started applying for student jobs where I worked as a tutor for both chemistry and biochemistry. This job actually introduced me to the world of academia and awakened me in an urge to continue growing in my skills, my knowledge base and expertise to join this elitist fraternity of academics. I obtained that degree with distinction. I set out to pursue postgraduate student studies and registered for a BSc Honours degree in pharmacology, where I received the NRF Honours Innovation Block funding, which covered my tuition costs. This is the year in which the support structures that are offered by the University of Pretoria came together to support me in ways that I could not realize at the time. Under the supervision of my mentor, Professor Werner Cordier, I conducted a research study that was aimed at developing advanced cell culture models for breast cancer. During this period, Professor Cordier pointed out some of the support services and support available to postgraduate students and encouraged me to pursue learning and opportunities to ensure my ultimate success. I received training on various aspects of research, such as an introduction to biostatistics, research methodology, research presentations, and scientific writing. I was fortunate enough at honors level to present my findings at a national conference, and through this initiative, I was exposed to pharmacology research in a broader context. I completed that degree with distinction as well, and as a top student within my class. So without hesitation, I then registered for a master's degree in pharmacology, where I expanded and investigated additional objectives, building on to my honors research project. Again, having been steered by my supervisor, I had successfully applied and obtained the NRF Innovation and Priority Research Areas Master's Scholarship that covered some of the tuition costs as well. I presented the findings from my master's project in local and national conferences and in an international conference in Kyoto, Japan. The Faculty Research Office additionally invited me and identified me to submit an application, which led me to being selected to be one of the 600 top young scientists in the world to meet Nobel Prize winners in Germany. This was in 2018. Having completed my master's degree with distinction again, I am now registered as a PhD candidate in pharmacology, as well as a lecturer within the same department. I teach various basic and clinical pharmacology modules and enjoy how my passion for this subject actually wins students over. My PhD study is focused on developing and characterizing a reliable cell culture model for breast cancer. This is in a bid to provide a laboratory platform for studying anti-cancer drugs before they can actually be investigated in human beings. I am also primarily responsible for training honors students within the aspect of scientific presentations. I know that if I want to pursue a career, which is a full-time career in academia, I need to look for the opportunities to grow and hone my own skill set that is offered by the institution. This has led me to accept the nomination by the School of Medicine to be appointed as the School of Medicine's Research Committee as a postgraduate student representative. I know that to build my own track record as an emerging researcher, I need to pursue other endeavors outside the university. Hence, I agreed to serve as a blogs author for the South African Young Academy of Science. And more recently, I've become immensely involved in various scientific committees for various conferences. I believe that this exposure will guide me on the next step as a young researcher, and I know that I am fortunate to be in an institution where I have been afforded the opportunities and received the guidance that has brought me this far. I am looking forward to the journey post my PhD and know that with my willingness to continually grow, learn, and with the platform that I have received at the University of Pretoria, I have been set to fly as an emerging researcher. Thank you so much.
Wow, Keith, your story is so moving. It truly shows that hard work really pays off. Keith, we are so proud of your achievements and your dedication, your enthusiasm. We can't wait to see. I'm sure we will hear more from you in the future.
Thank you.
Next, we have Dr. Takalani Makantisa. Dr. Takalani is a PhD candidate in entomology at the University of Pretoria's Institute for Sustainable Malaria Control. Welcome, Takalani.
Thank you so much, Dr. Takani. Appreciate this opportunity. I am currently enrolled for a doctoral degree at the University of Pretoria. I started my postgraduate journey as an honors student with the Department of Biochemistry in the Faculty of Natural and Agricultural Sciences with a primary focus on the malaria parasite. By virtue of my research interest, I became a member of the Student Forum of the University of Pretoria Institute for Sustainable Malaria Control, which is the UPICMC. My research interest is in vector-borne diseases, particularly those transmitted by mosquitoes, such as malaria and rift valley fever virus. This is personal to me, as I am from Limpopo Province, the Bembe district, an area with the highest prevalence of malaria cases in South Africa. I want to be part of a solution that brings relief to my people back home. My affiliation with the University of Pretoria Institute for Sustainable Malaria Control that is focused on sustainable malaria control opened up research opportunities for me at master's level. I've always been keen to ensure that the research I conduct is translated into a publication to ensure that new knowledge around vector control contributes to advances in treatment and prevention systems. During my honors year, I co-authored a publication titled Understanding Human Genetic Factors Influencing Primaquine Safety and Efficacy to Guide Primaquine Rollout in a Pre-Elimination Setting in Southern Africa. As a master's student, I became more interested in studying the vectors of malaria and decided to pursue an MSc degree in entomology with a focus on malaria vectors. For my MSc, I received joint supervision from the Faculty of Health Sciences and the Faculty of Natural and Agricultural Sciences. My MSc degree was titled Effectiveness of Selected Cattle-Administered and Exercise to Reduce Malaria Vector Mosquitoes. I completed my master's by publication and published 2 articles as first author. I also obtained my degree with distinction. I'm currently registered with the Faculty of Veterinary Science for my PhD degree. My focus is on Rift Valley fever virus, and my thesis is titled Entomological Studies of Rift Valley fever virus in KwaZulu-Natal Province, South Africa. My PhD research focuses on mining new knowledge that can contribute towards understanding the Rift Valley fever virus ecology and improving current disease prediction methods and control strategies. I have 3 publications under my belt and another 3 to follow on completion of my doctoral degree. For both my honors and master's degree, I had 2 supervisors from the University of Pretoria, which greatly benefited me as the 2 viewpoints offered inspired me to find my research voice and research niche quite early in my journey. My supervisors also offered great mentorship and guidance, encouraging me to publish from an honors level, although it was not compulsory. With their support, I have had opportunities to share my research findings at national and international conferences. One of the highlights was when I presented my MSc results at the American Society of Tropical Medicine and Hygiene conference in the United States of America in 2019. My postgraduate journey was made easier through my access to funding support. For my MSc degree, I was funded by the National Research Foundation Master's Scholarship, supplemented by the Dr. Sylvia Meek Scholarship for Medical Entomology through Malaria Consortium based in the UK, which funded my publication fees and other operational costs linked to my study. For my doctoral degree, I am funded by the EcoHealth Alliance Scholarship based in the USA and the National Research Foundation. It amazes me that with my research interest in vector-borne diseases, I've been afforded opportunity to spread my postgraduate journey across 3 faculties. This makes my training truly transdisciplinary. The varied exposure to different techniques and practical teaching and training has afforded me a unique training experience. This type of accessibility is why UP graduates are highly employable and sought after. I believe this will translate into me finding the right fit job where I can continue to add value and new knowledge in the fight against vector-borne diseases.
Wow. Thank you, Dr. Takalani. Your story is so inspiring. How you found connections through different departments, that is remarkable. Your hard work and your passion encourages us, and it also shows that innovative and transdisciplinary collaborations are possible at the University of Pretoria. An important takeaway from the 3 experiences shared with us is that postgraduate students at the University of Pretoria's Faculty of Health Sciences are uniquely positioned. They are doing remarkable things in their fields. They are doing research that matters. You guys are truly life changers. Our dynamic postgraduate students' journeys are a true testament to the amazing opportunities and the support available at the University of Pretoria's Faculty of Health Sciences. The next part of the puzzle, we have Mrs. Annette Velman. Ms. Velman is the Senior Coordinator for the postgraduate students, and she is based at the Faculty of Health Sciences. Together with her team, they provide administrative support services to all our students from application all the way through to graduation. Ms. Velman, we're happy to hear from you.
Thank you. Well, you've heard now these wonderful students. It all starts with an application. So I'm in the Department of Student Administration and responsible for the postgraduate studies. We provide an administrative support service to all our students from your application through to your graduation. For ease of reference, I'm sharing contact information with you on the screen. Always remember that you have the Student Services Centre on the Hatfield campus. They are basically at ssc@up.ac.za, so you can inquire with them. But if you want to inquire regarding student-related matters, applications, selection criteria, visit the Faculty of Health Sciences portal to log a query or send an email to healthsciences@up.ac.za. I would also like to invite you to visit the Frequently Asked Questions webpage, as some of your burning questions might be answered right there. But I want to take a few minutes to touch on a few health sciences specific frequently asked questions that we receive. The first relates to international students. On the link shared with you with the frequently asked questions, there are already details regarding your application, admission, fees, the medical aid that you need in South Africa, accommodation, and a number of important details shared with you. We often receive the following questions. What documents must postgraduate international students submit? Obviously, certified copies of all degree and diploma certificates that have already been evaluated by SAQA. That's the South African Qualification Authority. This needs to accompany your application. This is very, very important. Such an evaluation might take quite long to process and is therefore your first step in the application procedure. Inquiries about this evaluation and the requisite fee must be addressed to SAQA themselves, and they have an email address that is, or a website that is saqua.org.za. The second question relates to funding, and we've already spoken a lot about funding, and these three wonderful students also shared their funding stories with you. So please visit the funding part of our website and study it in detail. But what is important for international students are that external funding is sometimes very limited for international students. So you are also advised to do your own research in your own country, to visit your research foundations in your country and councils before you apply here, but then obviously also visit our funding websites and make sure that you apply for what is applicable to you. Also ensure that you take note of all the relevant information with respect to your visa applications, fees payable, funding, scholarship, external bursaries, etc. In addition to the above for the international students, we often receive inquiries about the following. The selection of all potential honours and master students who are conditionally selected, like Keith for instance, will only be finalized when the final marks are available. If you apply to the School of Health Systems and Public Health, their applications already closed at the end of July. Their selection period is fairly long because of a lot of applications, but it's normally over and done with by the first week of November. If you are interested in doing a PhD here, it's important to write a short research proposal and send it to the department in which you are interested in studying to determine if the department can accommodate your research that you're interested in and if they have a potential supervisor for you. Like Candace said, she first selected her supervisor. And like I already told you, if you're a prospective international student, it is compulsory to first apply to SAQA for the verification of your qualifications. If you are an internationally qualified doctor and you want to specialize, you need to contact the specific department in which you are interested to determine if they have supernumerary registrar posts available. Supernumerary means a registrar post without a salary, which means that these doctors must organize their own funding. If you are a nurse who want to further your studies, we have several postgraduate diplomas that will be available soon. There will be a variety of specializations like nursing management, education, primary care, ICU, etc. And some of these will be offered fully online. They are, however, not yet approved. These postgraduate diplomas will give nurses that only have a 4-year diploma the opportunity to do postgraduate studies, which will enable them to continue with a master. So it's a wonderful opportunity. In conclusion, please know that our student admin officers are here to help you with all your queries, from your application to your registration, applying for exemption of modules, advise you on your protocol preparation, right through to the submission of your dissertation or thesis, and eventually your graduation. We have an open door policy and welcome the opportunity to assist you, so please contact us if I have not addressed your questions today. Thank you.
Wonderful. Thank you, Mrs. Velman. I think most students have a lot of questions, and you've gone through all the frequently asked questions, so please don't be afraid to reach out. Her team is dedicated to offering unwavering support to our university community. As we reach the close of our event, I would like to thank everyone, all our esteemed speakers for the day, our Dean, Professor de Jager, our Deputy Dean for Research and Postgraduate Studies, Professor Mashamba-Thompson, our postgraduate students for being so candid and sharing their experiences with us, and Mrs. Annette Velma for her dedication to supporting postgraduate students. In closing, the faculty is committed to nurturing a new generation of healthcare professionals with innovative research-driven teaching, a 21st century library with advanced technology, esteemed researchers, supervisors, a postgraduate roadmap to guide you through your journey, dedicated support systems, and multiple funding opportunities. The University of Pretoria's Faculty of Health Sciences is ready to equip you. We're ready to equip you to address the evolving healthcare landscape. Are you ready? Are you ready to embark on this extraordinary journey? We look forward to seeing you in our faculty. Choose the Faculty of Health Sciences at the University of Pretoria for your postgraduate studies and be a life changer.